reason why the Norton School and Wound Care Education Institute came together in this project to offer a specialized certification course came from the knowledge that there was a natural bridge that could be built between the wound care specialist and the lymphedema specialist.
And I'm from Muskegon, Michigan. I'm a podiatrist, and I am board certified with the American Professional Wound Care Association, also the National Alliance of Wound Care.
You could take one and have it below the hip. In order to have the stock in it that's going to fit on her thigh, I'm going to have...
We see that we can heal wounds almost miraculously just by controlling edema, and that information needed to reach the wound care specialist.
But I certainly have gotten a much more thorough understanding of that and an appreciation for what my therapists are trying to do if I am ordering that type of therapy.
90+% of all wounds exist in a swollen environment. And so this course really addresses the different types and causes of swelling that exacerbate the wound healing process.
My favorite part of the class has been the amount of hands-on practical work that we get every day throughout this course.
This is a true lymphedema class. We teach about lymphedema therapy, but we really designed the class to be for people who work with wounds all day, every day.
We've seen many times where a wound that hasn't resolved in 5 years resolves in 5 weeks when you start to manage the edema.
That there's some real benefit from the modalities, the way that we apply compression, the way that we understand compression, and the way that we can modify compression that really can work well in the wound clinic.
I would recommend this course to anybody who is interested in incorporating wound care with lymphedema.
The way the class is structured is a very nice blending of didactic and practical learning. We spend a good portion of the day actually on massage tables, treating each other, practicing bandaging applications and manual lymph drainage, which is really where the rubber meets the road in the clinic. This is how you get good results with edema. And so we really check people for their competency level at the end of the course to make sure that they're going to apply a safe bandage, that they're going to apply appropriate manual lymph drainage to ensure the best outcome.
When you have a lymphedema understanding, it helps to fill in a lot of the gaps, maybe take your understanding further in what's happening with your patients, but then also to take your skills in applying compression and perhaps manual lymph drainage to improve
I can't tell you how little physicians know about what nurses are trying to achieve and therapists are trying to achieve, and to tighten that network a bit is just very important that they all take the class.
Maybe have better outcomes, not maybe, but surely have better outcomes in the clinic. But we gear it very much towards somebody who works in wound care every day, all day long.
When I go back home from this course, I am extremely excited, first of all, to go back home and incorporate all of the techniques I have learned